there's a trend in skilled nursing facilities around the country. And this trend started a decade or two ago, maybe even a little sooner than that. And it's young adults moving into skilled nursing homes. So this is a 4-part video series. It's a 4-part article series because there's so much to talk about in this area. As a matter of fact, I've put together a full, I think it's a 90-minute or a 2-hour presentation on younger adults in skilled nursing homes. So this is Younger Adults in Skilled Nursing, Part 2. Hopefully, you could find Part 1 on my blog, drjimcollins.com. But in this particular article, I talk about how they describe their lives. So you have younger people moving into skilled nursing homes. They're being admitted from the hospital right into the nursing home. They're coming in pretty sick. A lot of them have many co-occurring disorders: cancer, heart disease, AIDS, diabetes, stroke, and so on. But they're also coming in with diagnosed substance use disorders. And skilled nursing homes are for older adults and seniors, not necessarily younger adults. I'm talking 19-year-olds, 25-year-olds, 32-year-olds, 40-year-olds, and so on. And the environment is not exactly what I would call ideal for these individuals, but there aren't many other places for them to go to. So how do younger people who move into a nursing home, maybe they're going to live in a nursing home for the rest of their lives. I mean, this is very sad when you think about it. How do they describe their lives? Well, I did the research. I found out. Being a younger adult facing a future in skilled nursing for anywhere between 10 years, 20 years, 40 years or more can involve a lot of emotions like depression, helplessness, anxiety, hopelessness, anger, frustration. Many will move in with conditions including severe mental illness, neurological conditions and disorders, substance use problems, hemiplegia, quadriplegia, and more. And all of these make their lives in the facility even more difficult. What are younger adults saying about living in a nursing home? I found some general themes. Although everyone's experience is going to be different and some younger adults do adjust better, so let's not paint this horribly dark picture. Some young people who move into a nursing home actually have it better in the nursing home than they did in their own home, in their own community, apartment, or maybe they had nowhere to live. So despite that, everyone's different. There are some common themes, though, which characterize how they feel about their lives in a skilled nursing facility. And these general themes are as follows. Number 1, the feeling of confinement. That's an awful feeling. Younger adults want to get out and have a life outside of the nursing home. But if they can't as much as they would like to, they can experience a sense of being confined within the walls of the facility. Being bedridden or relying on a wheelchair can make matters even worse. Some will feel helpless due to their physical condition and hopeless because there simply is nowhere else for them to go. Another theme, lack of socialization. Most younger people would prefer to be with their peers or younger residents, but instead, they're most likely to be surrounded by old, frail, confused, or dying seniors. They would rather be a part of a wider community of similar aged and like-minded individuals, as well as their personal friends, families, and significant others. They would also prefer age-appropriate activities that they find interesting and enjoyable. Another theme, lack of privacy. Although I hear lots of seniors talk about this one too. Although everyone, to a degree, wishes to have privacy, younger adults have been found to want it more than older residents do in skilled nursing. Isn't that interesting? They especially want privacy during personal hygiene routines, and they're not satisfied sharing bathrooms with older adults, as is still the case in a number of nursing homes. More so than their older counterparts, younger nursing home residents are more sexually active and wish to have private time for intimacy with a partner. Another theme, lack of appropriate settings to accommodate younger residents. Can skilled nursing facilities really meet the needs of younger residents? Is the physical layout attractive and welcoming to a younger person? Younger adults see nursing homes for old, sick, and dying seniors, not a place for them. Again, these are themes I've found in research. They may never adjust to the point where they accept that nursing home as their true home. Another theme, loss of identity. Being younger, physically compromised, dealing with mental health and substance use issues. Those are all tough enough. Chronic feelings that one does not belong can make life even more difficult. Some younger adults may feel their personhood is actually slipping away, and they're no longer in control of their lives. I wrote an article, if you'd rather read it and share it. You'll find it on my blog, drjimcollins.com. And then I found some quotes about how they feel about living in nursing homes, what they describe in terms of their life. What is their life like now? These are in their own words, okay? Although there doesn't exist a lot of scientific or academic literature on this particular topic, a handful of studies captured exactly how some younger residents feel about living in a nursing home. And here are the quotes. This place is for older adults who are dying and have dementia. The quality of life is terrible. I feel like I'm talking to my mother all of the time. It's just not normal. I don't fit in. Everything is timed. When you eat, when you sleep, when you do this or that. This place makes you feel like a captive. It's hell to live here. And every day is the same old story. Those are all negative comments, but those are in younger people's own words who actually live in a nursing home. Other feelings and experiences of younger residents include boredom, loneliness, unmet needs, disconnection, not being sociable enough, having a lack of control, devoid of meaning, empty landscape of time, and depression. It's a lot. This is a heavy talk here. Final thoughts on younger people moving into skilled nursing and how they feel about it. Younger and middle adulthood are times of growth, stability, and success, but not necessarily for those living in skilled nursing homes. Various physical and mental conditions may be difficult to live with, but spending years in nursing facilities, being unable to go out, being detached from same-aged peers, lack of privacy, and feeling as though one's identity is becoming lost can make life not only dull, but depressing. So I hope I didn't bring you down. Didn't mean to. It's reality. It's a trend. Younger people are ending up in skilled nursing homes across the country for a variety of reasons. And it's not necessarily the best place for them to be, but in many instances, there's nowhere else for them to go. So I'm Dr. Jim. This has been Younger Adults in Skilled Nursing, Part 2. Remember, there are 4 parts. How they describe their lives. I hope you enjoyed the video. And if you're looking for online continuing education, CEUs for your own license, check out CEU Academy, where we create fresh content every single year, very timely, important topics. And tell your colleagues who are licensed healthcare professionals as well. Follow the link below and check out ceu.academy.